Welcome to the Midwest Senior Services Legionnaire's Requirements Informational video. Midwest Senior Services is a consulting firm that serves customers all over the United States. We specialize in compliance issues ranging from emergency preparedness to safety to water. Compliance is something that everyone needs to keep in mind, and we all know it can be overwhelming. Today, we are going to talk about the new Legionnaire's regulations. These went into effect in June of 2017. Many healthcare providers were not aware of it because they were in the midst of the new Medicare requirements. When we talk to people, a lot of times we hear them say they have not heard of it, or that they have their water program under control. They often think their water program is the same as anti-scald regulations. This is not the case at all. For an overview of what these new regulations are, let's watch this video.
Is your building a healthcare facility where patients stay overnight? Does your building primarily house people older than 65? Yes? Then you are now required to have a water program to prevent Legionnaire's disease. What is Legionnaire's? It is a very serious type of pneumonia caused by bacteria called Legionella. Legionnaire's disease kills 1 in 10 people that contract it, and cases are on the rise. 19% of cases are connected to long-term care facilities and 15% to hospitals. Legionella grows in water and is spread through water droplets that are inhaled. It can grow in parts of water systems that are continually wet. Common sources of infection are showers, cooling towers, decorative fountains, and hot tubs. Certain people are more at risk for Legionnaire's, including people over 50, current and former smokers, people with chronic lung disease such as emphysema or COPD, having a weakened immune system from diseases like cancer, diabetes, or kidney failure, and people on certain medications that weaken the immune system. Where did this come from? Who is requiring it? The Center for Disease Control, CDC, has developed the new requirement, and ASHRAE, American Society of Heating, Refrigerating, and Air Conditioning Engineers, has developed a standard to which all buildings will be held. Who is enforcing it? Medicare will be enforcing the new regulations for hospitals and nursing homes. They are required now to be in compliance. Other agencies will be enforcing for other required buildings, including licensing entities and OSHA. What do the regulations say? That all facilities that serve the elderly and those with compromised immune systems must have a program to sanitize water and ensure its safety and freedom from infection. You must have a water-specific risk assessment done, a water management program that considers industry standards and includes control measures such as physical controls, temperature management, disinfectant level control, visual inspections, and environmental testing for pathogens, and specify testing protocols and acceptable ranges for control measures, and document the results of testing and corrective actions taken when control limits are not maintained. If you do not have this in place, you will be cited for non-compliance with the Medicare conditions of participation, and other agencies may get involved as well. So where do you start? You want to be sure you are getting help from the right people. Midwest Senior Services brings together a team of engineers, healthcare experts, and consultants to build a program that is designed for your building. First, we make sure your building is providing sanitary water by doing a thorough inspection. Then, we have our engineers look at your water system and determine where your biggest risks are, and we help you make a plan to mitigate those risks. Next, we build a program specifically for your building and train your staff on how to treat and test the water in your system. Last, we set you up with a program to enter your test values into each week, and we will alert you if any are out of range. If they are, we will help you to get back in range. We even send you the testing supplies each month so you never run out. Call us today to get started. Our number is 515-523-8094. Let us help you get in compliance and keep the people you care for safe.
That is a lot of information, but based on what you learned in the video, how prepared are you for this new regulation? Whether you are a senior housing, nursing home, hospital, or just a building over 10 stories tall, you are now required to have this program by several agencies. Of course, nursing homes and hospitals know that Medicare will fine them or withhold payments if they do not fulfill this requirement, but what about other buildings? As we now know, cases of Legionnaire's disease are on the rise, and 1 in 10 of those who become ill with it die. If someone living in your building is found to have died from a preventable disease that you knew about but did not take action, what will happen? You could likely be found negligent in court and end up paying out a lot of money, face being shut down, and more. Why not take the steps to prevent this tragedy and avoid the fines, bad press, and regret? Let's break down the requirements. There is a lot to it, but it is completely doable in an affordable way from your own facility. Your staff can be trained to do this themselves. We have many ways to help, but we will get to that in a minute. First, you need to do a water-specific risk assessment. This involves understanding your water system. Where does the water come in? What path does it take? Are there high-risk areas? You need to identify these areas, then make a plan to mitigate the risk. Our agency produces these for only $499. You just provide us with blueprints or a detailed description of your water system, and we have our experts look at them and produce a detailed risk assessment. Next, you need a water management program. This program needs to consider industry standards and include control measures. To break this down, you need to understand how Legionella grows. Then include and consider industry standards, which can be found on the ASHRAE website. You can base your written program on these standards, but adapt them to your specific building. You must also include your control measures. You will be introducing a water testing program, which will be done based on a few different control measures. Control measures should include various tests. This part can get overwhelming, but you should be able to build it into maintenance duties fairly easily. The types of tests that need to be done on a weekly basis are chlorine residual testing, visual inspections, and temperature testing. The goal is to sanitize the water before it reaches the outside of your water system. To do this, you want your water to have a chlorine residual level of 2 to 4 parts per million. This ensures that there is enough chlorine in the water to kill any bacteria. Visual inspections are done to look for areas that look suspicious for bacteria growth. A lot of times this can include fountains with slime growing inside, as well as other things to look for. Temperature testing is also a way to test for the prevention of Legionella. This can be tricky because most nursing homes are required to have water temperatures below a certain number to prevent scalding. However, that number is within the range that Legionella grows best in. Water temperatures must be above 122 degrees Fahrenheit to prevent Legionella growth. Most states have guidelines for healthcare facilities between 105 and 115 degrees. Prevention and mitigation are the cornerstone of these regulations. Your program must have details about how you will prevent Legionella growth, and then, if it is found, how you will react and mitigate the risk. Prevention and mitigation strategies can take several different forms and are really specific to your building and your identified risks. You can build your own water program, but if you need help, we can do it for you. Our water programs always include the risk assessment and a one-on-one webinar training to make sure you understand everything in your program. We can do this for $2,750. If you feel like you really need someone to come out and do some hands-on training with your staff on how to do the testing and stay in compliance, we can do that too. Just call us for pricing at 515-523-8094. As part of your testing program, you will need to track your data. We offer a low-cost program that works on both your computer and as an app for your mobile device. As part of the program, we are able to send you testing supplies each month so you never run out. Just tell us how many checkpoints you have, how often you are testing, and we will provide you the testing supplies you need. You get supplies and the program for only $129 per month. You might be wondering what kinds of supplies you will need. What we recommend is testing 4 to 6 checkpoints each week, depending on the size of your building. Larger buildings may need up to 10. Each location should be tested for chlorine residual and temperature. We are able to send you the tools you need for this, as well as provide the tracking software. In addition to these control tests, you should also check for Legionella growth occasionally. We recommend doing this at least quarterly. We have a rapid test that you can do on your own that we provide 4 times a year with our tracking and testing program. If you choose to conduct more tests than that, these can be purchased separately for $189 each. There are companies out there that will do your testing for you for thousands of dollars a year. We know that that's not always in the budget, and we are here to help you be in compliance in an affordable way. Please give us a call if you would like to order any of the products we discussed. As a recap, here's what we offer. Water-specific risk assessment, $499. Water management program with risk assessment, $2,750. Water management program with hands-on training, call for pricing. Tracking and testing program, $129 a month. Extra Legionella test kits, $189 per test. If you would like to purchase, you may head to our website to sign up, www.midwestseniorservices.org, or call 515-523-8094 and ask for the water department.